phases of coagulation. Now, coagulation happens in a sequence. The first and foremost is the vascular phase, where an injury to the vessel wall happens. Next comes the platelet phase. What will happen if the platelet goes to the injured site? Third phase is the coagulation phase, where your coagulation factor comes into picture and form a nice clot. And finally, the fibrinolytic phase, where the clot which is formed with fibrin undergoes a lysis. These are the 4 phases of coagulation. Now coming to the first phase, which is the vascular phase. Here there is a injury to the vessel wall. So what is going to happen? This endothelial cells will release endothelin and cause local vasoconstriction. So by causing local vasoconstriction, it will try to reduce the bleeding. And another important thing is exposed collagen fibers. Here the collagen which is here gets exposed. These 2 things happen in the vascular phase. Localized vasoconstriction by endothelin and later they expose collagen fibers. This is vascular phase. Coming to the next phase, which is called the platelet phase or primary hemostasis. The first thing which happens is your platelet gets added to the site of injury. That is the first one. And second is this platelet, which is normally disc shaped, undergoes the morphological change. Okay, there is a shape change in platelet. And third stage is the platelet releases the granules which contains ADP and thromboxane A2, and this helps in recruitment of more platelet coming to the site of injury, and finally aggregation of all platelet happens, which is called primary hemostatic plug. This is the platelet phase. Now coming to the third phase, coagulation phase, where all clotting factor comes into picture. Okay, first is it all starts with the tissue factor release. Okay, thromboplastin is released, that is tissue factor release. Next is all the clotting factors one by one comes into picture. So both the pathways are old concept, now it is a new concept, but all the clotting factors will be released. Then calcium activates this phospholipid complex, which goes into the thrombin activation. Okay, once thrombin is activated, it converts fibrinogen to fibrin to form a fibrin mesh. That is the coagulation phase.